Hi, I'm Ryan Simmons, Doctor of Physical Therapy with MoveMend, and I'm here to demonstrate for you a pelvic correction exercise when your pelvis is out of alignment and you have low back pain. Oftentimes people complain of pain that's very low in their low back. Sometimes you can identify this pain by looking at the low back and seeing dimples. So this is the SI joint, the sacroiliac joint, where the tailbone joins the pelvic bones. So sometimes one of the pelvic bones can come out of alignment and tip forward or backward. And so today we're going to be addressing that issue on Erica. So Erica has a right-sided pelvic malalignment, and her pelvis is rotated forward in this direction. So we're going to use her right gluteal muscle, which is her buttock muscle, and her left hip flexor muscle to balance the pelvis. And this is how we're going to do it. We're going to bring Erica's left leg, so the non-involved leg, up to a 90-90 angle. So 90 degrees of knee flexion and 90 degrees of hip flexion. And she's going to take her hands and press against her knee so that her knee is going this direction and her hands are going this direction, producing an isometric contraction, or a contraction where there's no movement, but there is muscle activation. She's then going to align her foot with her hip. She's going to tuck her pelvis under a little bit or roll it back towards her face. And then she's going to use her gluteal muscle to lift her hips up off the mat. And then she's going to press her knee into an imaginary wall just gently. So I'm actually putting my hand here so she can press into my hand, and she's holding for 10 seconds. And then she's going to come down, take a slight rest, and then she's going to bring it up again and hold for 10 seconds, pushing here and using her gluteal muscle on the right side or the involved side. And then she's going to relax, and then she would repeat that one more time. And then after she's done there, she's going to bring her leg down here. She's going to use something to squeeze between her legs. We have a ball. You can use a pillow and fold it in half, a dense pillow. And she's going to squeeze that ball or pillow, tuck her pelvis under, make sure she's using her inner thigh muscles and her core, and hold for 10 seconds. And then relax. And then she's going to squeeze that ball again and perform one bridge bilaterally or with both legs, lifting, performing a gluteal squeeze with both hips, and then she's going to return down to the table. You can repeat that bridge 9 more times. We're not going to do that in the video, but you can repeat that again just to solidify the pelvic alignment. Thank you. My name is Ryan Simmons with MoveMend, and this is an exercise for correcting pelvic alignment.